Each year, approximately 795,000 people suffer a stroke. By far the most common type of stroke is an ischemic stroke. This type of stroke occurs when the carotid arteries are blocked.
There are actually two carotid arteries. One is located on either side of the neck. Basically, the easiest way to think about it is if you've ever seen a runner stop to take his or her pulse, that's what they're feeling, the carotid artery. So as I said, there's one on either side of the neck, and basically they're the two main blood vessels that go to the brain. And that's where the brain gets most of its oxygen from. The reason the carotids are so important is that if they become diseased or if blockages build up in them, then this can impede blood flow to the brain. If a blockage like that occurs, either the brain can become deprived of blood or a small piece of that blockage can break off and travel up to the brain, resulting in a stroke.
In the vast majority of cases, ischemic strokes are a sudden, catastrophic event. However, some patients may experience a warning or mini-stroke. These are called transient ischemic attacks, or TIAs. These occur when the blockage is only temporary.
What that means is that there is a symptom of something going on in the brain, such as a temporary inability to speak, to see in one eye, to feel or be able to use an arm or a leg. This can last for a matter of minutes to an hour or two, and then it resolves and the patient goes back to normal. So that's a warning sign that the patient may be at risk for developing a full-blown stroke.
If you or a loved one ever experiences any symptoms of stroke, no matter how fleeting, you should seek medical attention immediately. A third of patients who experience TIAs have a full-blown stroke within a year. It's for this reason that we want to diagnose and treat any blockages that may contribute to a future stroke. We can immediately eliminate blockages by either surgically implanting a stent or by performing a procedure called an endarterectomy.
Endarterectomy is just a fancy word for cleaning out a blood vessel. And basically what we do is make a small incision on the side of the neck. We go right down to the carotid artery, open it up, clean out all the plaque until it's wide open, and then just close it up again. And most of the patients are asymptomatic, so they really don't feel any results. What I stress is that the purpose of the surgery is to reduce the chance of having a stroke. So the patient's not going to feel any different except for a small incision on the neck. But again, the important point is they're no longer at a high risk of having a stroke.
Once the threat of the blockage is removed, we can focus on trying to prevent further blockages from developing. We do this by diminishing your risk factors.
The risk factors are high cholesterol, poor diet or a high-fat diet, genetics, and low or no exercise. Same things that contribute to disease of the heart or coronary disease. They really go hand in hand. But the best way to prevent it would be eat a healthy diet, exercise regularly, and obviously no smoking. Smoking actually has a very deleterious effect on blood vessels. And what I always tell patients who smoke is it's essentially like injecting poison into your blood vessels. It has a very irritating effect on the lining of the blood vessels, and it promotes the development of plaque.
With treatment and proper medical supervision, we can prevent a catastrophic stroke from occurring in the future. Then, you might be glad you had that TIA. It gave you enough advance warning to make some adjustments and prevent a medical emergency. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.